Take a few moments and come with us. We're about to drop in on the 25th annual Long-Term Care Symposium that's going on as part of Medicine Week here in Brevard County. We're going to meet some of the people that are responsible for bringing some of the best care possible for the people and citizens and the seniors of Brevard County. The gentleman who's the executive director of this event is Jeffrey Fisher. And Jeffrey, I think you're pretty happy with the turnout, aren't you?
Oh, absolutely. It's usually a very large turnout every year. This is the 25th year that we have been doing this. It started out as a very small group. Now it's grown up to about 500 participants. So, yes, I'm very happy about the attendance.
I don't think necessarily the general public is aware, but this is a free dinner to just actually honor and say thank you back to the people who do the work, aren't they?
That is correct. It is for all the healthcare workers in Brevard that do work at the assisted living facilities and the skilled nursing facilities. It is free to them. They come and get CEU credits. We put on a nice show for them, and everyone goes home happy.
And they get to talk to vendors who are the people that are providing them with the medicines and the information that they need to do their job.
That is correct. Without the support of our exhibitors and vendors, we wouldn't be able to make this happen.
Right. Now, what do you see in the future? I mean, I was talking to John a little while ago, and he said that he sees that actually care is getting better and we're increasing in volume. What are the visions that you have for this?
Well, I would just like to see the community much more involved in this. The more the community is involved, the better a turnout we have, the more people are aware of what's going on medically in this arena as far as long-term care goes.
And long-term care, I mean, a lot of us are headed in that direction.
Fastest growing segment of the population.
Now we're going to be speaking with Dr. John Angel with Sanofi, and you're one of the vendors here. You're providing services to the medical industry, and what is the specialty?
Well, we have had the opportunity to be a partner with this group a number of years in a row now, and we have sponsored the dinner, and we have the opportunity to further education around diabetes for the long-term care community.
You have an insulin on the market, is that correct?
We sure do. We have the market leader, Lantus.
And the history of insulin, I'm going back, goes all the way back to when they were using bovine insulin and things like that, which was not always conducive. Now we've got things that are a lot more body friendly.
Yes, insulin has certainly come a long way.
Yeah, exactly. Now, what happens this evening for you people, for your people here, getting together with all these other people and having a chance to talk about the industry?
We do. We have the opportunity to mix and mingle. We have the opportunity to meet new people and answer questions to customers that we may not otherwise be able to see.
And you have one of the speakers this evening, too.
We sure do, yeah.
And what are they going to be speaking on?
Mr. Don Zetterwald has been a speaker for us for a while. He is going to speak on diabetes in the long-term care setting.
Do you foresee, or is there a possibility that there is a cure for diabetes, because it seems to be growing rapidly here in the United States?
Diabetes is a major healthcare expenditure. I don't know of any cures, but we're certainly doing our best to treat the patients that do have diabetes.
And now the man that put this all together originally, and now 25 years later, we have the annual Long-Term Care Symposium, Tom Petoskey. And Tom, well, first of all, for the community, thank you very much for all that you've done. Now, tell me what it was like 25 years ago. Did you have like 3 people show up?
No, well, 25 years ago, we decided to have some education for people that were involved in long-term care. There's a lot of medical programs for people in acute care, but there wasn't anything for long-term care. So I got a couple sponsors, and we put together a meeting, and we had 80 people show up the first year, and it was at one of the hotels in Satellite Beach. And over the years, it's grown and grown. We only had 1 speaker the first year. Now we have 3 speakers plus a keynote address, and we have over 450 people registered this year.
Let me ask you this. Where do you see long-term care going? What do you see we're lacking? What do you hope to accomplish? What are the successes?
Well, long-term care, there's been a big transition, especially since I started years ago, because what is happening now, the nursing homes have become rehab centers. Because in the hospital, Medicare has, they call DRGs, diagnosis-related groups, and they only allow a certain amount of time for patients to be in the hospital with a certain diagnosis, let's say, for instance, congestive heart failure. many years ago, when I started working in the hospital in 1970, when you had an illness, you stayed there till you got well.
Right.
Then eventually it transitioned, you stay there till you got stabilized. But nowadays the hospital just keeps you, and the nursing home, which is now the rehab, has to stabilize you. So they keep you for 72 hours, and you qualify for Medicare benefits. So what has happened is that the long-term care facilities have become subacute facilities. So they're taking patients that are not stabilized yet and having to stabilize them and rehab them and go home. So the former nursing homes that used to do long-term custodial care, now that's being shifted to the assisted living facilities. And they are becoming the nursing homes of yesteryear. And then the old assisted living facilities are going into now independent living facilities with home health care to help them. So we have people here today that are across the whole spectrum, from the nursing home, rehab center, assisted living, home health care, hospice, the whole healthcare spectrum.
Yeah. So the outlook is good?
The outlook is good. There's going to be a shift, and we're going to have to do more with less, because there's always cutbacks in healthcare and government, but we're going to have to work it efficiently and smarter. And that's why the purpose of this symposium is to give some education to providers that work in this environment of how they can do things more efficiently, up to exceed the standard of care in the community, and take good care of their residents.
We are talking with Mark Tesekkur from Johnson & Johnson, and you're one of the major sponsors for this. Why do you want to participate in an event like this? Why does your company want to participate?
Well, you know what, Danny? The Long-Term Care Association of Brevard County just does wonderful, wonderful work. And the physicians and the staff that service these areas are special. And Johnson & Johnson wants to become a part of that movement and provide the support. And that's why we're here, supporting them.
As a company, where do you see this country going in the field of geriatric medicine?
As a company, well, Johnson & Johnson's always looking for opportunities to better serve geriatric patients and geriatric disease states. So as the population ages, there's a greater need. We've got to be there to provide services that are needed.
And how do you think we are doing as a country? Are we preparing ourselves for this large amount of people that are moving closer to retirement?
Boy, Danny, you know what? It appears to me that we are, but I don't have the crystal ball to look into the future. But I know the folks that we've got here in Brevard County servicing this community are incredible.
And your company is going to be on the forefront?
Oh, absolutely.
I'm talking with Dr. Mariana Zelenak, who is a internal medicine doctor, and she's in the process of dealing with our aging population. And are we doing a good job?
Definitely, definitely. It's very important to have a good primary to put together the pieces when someone goes out and sees a cardiologist or pulmonologist. It's good to have that solid foundation where you can put everything together and see the main process and how the patients are doing.
The family doctor is now more of what your title is, right? Internal medicine?
Yes, internal medicine and geriatrics. So it's a primary field.
Right. So you would be my primary doctor, and you would tell me the specialist that I would need to go to, like cardiologist or something like that, correct?
Definitely, when the disease process gets complicated enough.
Right. Now, the population is aging. More and more people are reaching the age of retirement and for need for other medicines and assistance. Are we prepared to meet that need?
We definitely need, there is a need in geriatrics specifically, and for more primary doctors.